Yes, sir.
A very good afternoon to all of you. As you all know, yeah, आगे आ जाइए. Today we have assembled here for the 15th lecture under our monthly scientific interactive series. For today's lecture, we have with us Dr. Suresh Jain, Professor of Air Pollution and Health, Department of Civil and Environmental Engineering, IIT Tirupati. A warm welcome, sir. We are pleased to have you here.
Thank you very much, sir. Thank you.
So, with the permission of the chair, I would like to request to proceed further and request our member secretary, Sri S. Chandrasekhar ji, for his welcome address.
Good afternoon to all of you. In the outset, I would like to welcome our Honorable Chairman, Bihar State Pollution Control Board, for this 15th scientific lecture series. Also, today we have amongst us our esteemed speaker of the day, Dr. Suresh Jain, Professor of Air Pollution and Health, Department of Civil and Environmental Engineering, IIT Tirupati, right away from Tirumala. So you are welcome to this lecture for delivering this lecture today, sir. We are glad to have you here amongst us.
Thank you very much, sir. Thank you.
Yeah. Also here with sir, our colleagues from our State Pollution Control Board have joined us physically, and a lot of people have joined virtually, sir. Sir, for your information, this is an attempt by our State Pollution Control Board to disseminate the scientific information related to environmental conservation for the academia, especially the research-oriented people. As part of this, sir, we are regularly organizing the scientific interactive series for the last 15 months. This is the 15th lecture, sir, and we are glad to have you for delivering a speech on air pollution and health impact with special reference to vehicle pollution in India. Sir, with this intro, I welcome you once again and all my colleagues for this wonderful lecture series. Looking forward to hear you, sir. Over to Dr. Naveen, please.
Thank you, sir, for your warm welcome address. And I would request a big hand for our guest faculty today. And would like to request my colleague, Shri Arun Kumar ji, board analyst of this board, to introduce our learned speaker for today. Arun ji, please.
Thank you, sir. Good afternoon to all. Respected Chairman, sir, MS, sir, and our colleague members. And with warm welcome, Dr. Suresh Jain, sir, who is the Professor of Department of Civil Engineering and Environmental Engineering, Indian Institute of Technology, Tirupati. He is a learned man, and in fact, he is a prominent figure in the field of air pollution and health impact, which is today's lecture is on that particular subject, the air pollution and health impact with a special reference to vehicular pollution in India. I will say that his career summary. Dr. Suresh Jain is professor at the Department of Civil and Environmental Engineering and Dean Academic Affairs at Indian Institute of Technology, Tirupati, Andhra Pradesh. He had received his PhD degree in air quality modeling for urban transport emissions from the Civil Engineering Department, Indian Institute of Technology, Delhi, and Master of Technology in Environmental Engineering and Management from Indian Institute of Technology, Kanpur. He received a DAAD, a scholarship during his master's degree, and he worked on human health and ecological risk assessment at University of Stuttgart, Germany, from May 2000 to February 2001. Professor Jain has more than 18 years of research, teaching, and consultancy experience in the area of environmental science and engineering. Prior to joining IIT Tirupati, Dr. Jain was professor at Transportation Research and Injury Prevention Center at Indian Institute of Technology, Delhi. Dr. Jain also served as professor and head Department of Engineering, Department of Energy and Environment, Terry University, New Delhi. He was teaching postgraduate level course in various programs, that is MTech, BTech, MSc, and MBA, which includes air quality management, air pollution and climate change, environmental health and risk assessment, integrated impact assessment, and environmental system modeling, which has given him wide experience in various environmental issues. He is recipient of International Visitors Leadership Program, USA 2017, Vice Chancellor's Faculty of the Year Award 2017, Commonwealth Professionals Fellow 2016-17, UK, KTP Visiting Fellow 2014 by UTS Sydney, Roll of Honor by Terry 2012-13, and Ardhian 2013 Award by Wipro as a part of sustainability program. Professor Jain is working with many international groups such as UTS Australia, University of Zurich, University of Birmingham, UK, and Yale University, University of California, USA. Professor Jain is a member of a state-level appraisal committee, a state-level expert committee on environment, Government of Andhra Pradesh since November 2019. Professor Jain is also expert member of BRICS Network University on behalf of Government of India. Professor Jain was nodal officer from IIT Tirupati for Andhra Pradesh Pollution Control Board for implementation of National Clean Air Program at the state level, nominated by the Ministry of Environment, Forest and Climate Change, MOFCC, Government of India. Professor Jain is founding member of Global Center for Clean Air Research, University of Surrey, UK. He has experience of successful supervision and evaluation of postgraduate research students at doctoral level and master's level. He has 3 national books, monographs, and around 50 international peer-reviewed papers in journals to his credit. Presently, he is supervising 3 PhD students. He is a member of several professional bodies. He is also associated with the Ford Foundation, USA, and Open Society Foundation, UK, for International Fellowship Program. So, we have seen that he has a wide experience and in the field of air pollution. So, we are very happy with the Dr. Jain in this meeting. Thank you.
Thank you, Runji. So we are having a distinguished speaker today who will be discussing with us on a very important topic, that is air pollution and health impact, with special reference to vehicular pollution in India. So this topic is of much importance today. Yes, every day we are facing this air pollution issues, and always there is something to discuss about its contribution from the transport sector. So we are very happy to have Dr. Jain with us today. In fact, the other day we were discussing with Chairman Sir that we wish to have some to issue some health advisory during the winter days when the air pollution is at its peak. So, especially to our fellow citizens, what to do and what not to do. In today's talk, we expect that Professor Chan will be discussing about health with a special reference to health impact of air pollution, with a special reference to transport, and it's a nexus with the nexus between built environment, transport behavior, and environmental health. Because many times there is a blame game goes on that it is not this sector, the more pollution is coming from the other sector, transport is not that responsible, or something like that. And so we are very keen to hear you, sir. And I am sure my fellow participants will be benefited with your presentation. So over to you, sir, with very warm welcome. Thank you.
Thank you very much. And thank you, the chairman and the member secretary of Pollution Control Board, and all the scientists and the fellow scientist colleagues, Dr. Shah, for inviting me. It's a great pleasure for me to be part of this discussion, and very happy to see that Bihar Pollution Control Board is very actively doing such type of programs. And I believe this is not going to help mutual understanding of the scientific staff at Bihar Pollution Control Board, but at the same time, the wider community who is associated with this particular group. So thank you very much for giving me an opportunity and for detailed CV presentation. So I was not expecting that much of detail as to be presented, but thank you very much for your inputs. Today we'll try to talk related to the transport, air pollution and health. And maybe I'll just share my slides and just somebody have to confirm whether it's visible, so that, yeah.
Yes, sir. But better if you put it on slideshow mode.
Yeah, I will doing so. Just a minute. Yes, just a minute. Sorry, some technical glitch is coming. Yeah, I think that's fine.
Yeah. Yes, sir. It's okay. Thank you.
Yeah. Yeah, thank you very much. I will be talking on the transport related aspects, and then see like what are the most important components when we talk about air pollution. But generally, if we start with the air pollution, there are few important aspects we must understand. And most of the time we talk about that WHO says India is the most polluted country, or some of the cities which are most polluted in the world in India. So basically, I want to tell to all the scientific community, WHO, World Health Organization, never says that these cities are the most polluted cities in the world, or a particular country is the most polluted in the world. So they always collect the database from various countries or various cities, and then try to develop the database. And then based on that, people do interpret like which one is having more polluted and so. But whatever the database is available, among that, you will always see that which city is having more pollution and less. At the same time, the most important aspect is very important to understand is that air pollution don't have any boundaries, which we normally seek like other environmental aspects. When you talk about that, there may be certain boundaries are there, but in case of air pollution, there is hardly any boundaries are there. And the people who are more vulnerable, they are affected the most. Like, for example, I work with some of the outdoor workers like traffic policemen, the drivers, street vendors, street sweepers, you can say the people who deliver those, you can say lots of groceries. Nowadays, you talk about various type of options where the people are supplying the various food related items at your doorstep. So you can understand that entire day they are spending on the roadside or on along the roadside, and they are exposed the most. So that's where you can see the people who are vulnerable are like a particular group which are more vulnerable than compared to people like us when we are sitting in an air conditioned room. So it is not that the air pollution is damaging everybody in the equally. No, this is not the case. And that's why I always mentioned that the unequal, you can say, the exposure among the individuals are there. And then it is also very important to understand that the different modes are there. Like, for example, where you are, like if you are in a car, or if you are in a bus, or if you are walking along the roadside, or when you are using the bicycle, your exposure is completely different. So it's not like in 4 different type of mode of transport, your exposure is going to be same. And at the same time, the people who are already having certain disease, like for example, they are having asthma or lung related problem, respiratory problems. So they are always exposed like more. And that's why there are few determinants which make you more vulnerable or less vulnerable. I was talking about that we have started our some research related to the nexus between the built environment, travel behavior, and the human health. So which we found that this is the first time the study, even the global level, nobody have studied the nexus. People talked about 2 aspects at one time. Maybe they're talking about how built environment affects the travel behavior, or vice versa, or that how the travel will make an impact on human health as well. But this time we try to see how the built environment and travel behavior are affecting each other, at the same time how it is damaging to the human health. And you will going to see that travel behavior, it's not only one aspect. When you're going to see that air pollution from the exposure transport emissions, and then the exposure, the human health is one level, like the damage is happening. Travel also the results into the accidents also. And at the same time, the physical patterns, how exactly you are doing the different type of, you are using the different modes of transport. So depending upon your physical activity and mental well-being, it is also affected. It is also being affected because of the transport system. So, and then how a person decides, like whether the person male or female, like for example, in this particular study, we focused on the people who are working group, like professionals who work, use the transport system basically for the work, their work system. And at the same time, what are the different built environment properties or the aspects which influence the decisions, whether they will go for private vehicle, whether they will go with the public transport. So such type of system we have studied. And then we have looked into the environmental health aspects or the environmental impacts we have taken into account. And we have accounted the travel behavior, which we included. Even the lots of transport theory has been included, where we have seen how the perception or a behavior of an individual will be influenced by various reasons. Like it will affect the mode of transport, like the type of car trip, and the length and the trip distance, which is also being influenced by this. So if you see the daily urban travel, when we talk about that, there are various aspects which is related to this. Like for example, increase in the private vehicle dependence. Travel time is increasing because the congestion is increasing, the travel time is increasing. Speed, which is normally, in the urban environment, hardly 10 or 15 km/h speed we are now experiencing. And because of these reasons also, the fuel consumption is increasing. It's not like you are only using the private vehicle. So it results into, like, if the congestion is there more, so you are consuming more fuel, at the same time more emissions are released. And at the same time, it has been also observed that the looking into the current public transport, which is not really convenient to the public, and that's why people are moving more towards the private mode of transport. And the 2 reasons are there. Some cities are not well connected public transport system, and some cities are not having sufficient public transport system. So that's main reason, like it results into the problems. And what it results into: traffic congestion, infrastructure shortage, air pollution, human health impacts, and the noise pollution, which everybody is experienced now. And I believe like in Bihar also, Patna or main cities are also experiencing the same. How it is impacting us? Like, one is the exposure to the pollution level, and we know that pollution which released from the transport emission is highly, you can say, toxic, and especially when you talk about the diesel vehicle emissions, which are mentioned that it's a carcinogenic in nature. So WHO also have declared that the emissions exhaust which comes from the diesel exhaust pipes are also carcinogenic in nature. Then at the same time, lots of accidents and the physical activity. Like, more dependence on the private vehicle is also restricting your physical activity also, and that results into the impact on your mental well-being also. So it is not that the impact on the human health is directly because of exposure to the air pollution. It is also related to how physically you use, means what are the physical activities are there. For example, when I start from my home to my office, so if I'm going to the public, using the public transport, I may walk some distance, I will take the public transport, it will drop me some destination, and then again I have to walk somewhere. And while doing all this exercise, I meet people, I see people, and I see the surroundings, and certain physical exercise is there. So it having an other type of impact on the well-being of a person. But if you are mostly dependent on the private mode of vehicle, so it's very tough, these activities are missed, and then there will be an impact. It's not that both sides the impacts are which we perceive is same. Sometime when you are traveling by public transport, your exposure may be more, and when you are traveling by your private vehicles like car, air-conditioned car, there may be the exposure is less. But while doing this exercise, you are emitting more. Like, the person who is using more private vehicle are emitting more, and the person who is using the public transport is basically supporting the environment. So these are the facts which results into the impact on climate change or infrastructure breakdown or resource scarcity. So that's where you see how the transport becomes you can say, the lifeline of an urban city. But at the same time, if our urban transport system is not designed appropriately for the city people, or it's not able to meet the demand, then definitely you will feel such type of impacts are going to be there into the city, whether it is impact on the human health, stress, mental well-being. It could be in terms of the people who are already vulnerable, they becomes more, you can say, exposed to the pollution, and then their impacts are going to be more. And then definitely you see air pollution and climate change is now well connected. Emissions in terms of either you talk about carbon dioxide, or you talk about the black carbon, both are impacting the climate. And that's why the global warming scenario, everybody is exposed to. And I saw that recently, I congratulate presented their climate related activities, how the state is taking actions on that and going to be carbon neutral soon. So means these are the things which are very important, because if we work very strategically, I think one action may leads into multiple benefits also. So that's understanding is very important when we talk about the pollution level. So I'm sorry, this is a little congested slide, but it was trying to show that until now this is not has been shown, but I will with Dr. Shah and me in the group where we all are there. So you will be going to see we have developed this bath nexus, which talks about basically the built environment, travel behavior, and human health, how it is impacted by various aspects. So look, for example, we have given various aspects of built environment, whether it is land use, livability, neighborhood accessibility, transport infrastructure, density, diversity. So there are a number of aspects which are going to be important when you talk about the built environment. At the same time, when you talk about the travel behavior, it's like a travel demand, travel patterns, modal share, travel preference. All such aspects becomes very important when you talk about the human health, which I mentioned in previous slide, that mental well-being, physical activity, accidental risk, respiratory cardiovascular health. So all these are the functionality, or you can say the output of, like, once the impact is more, or in terms of the transport and usage is more, the exposure is also going to be more. That's vary from person to person, how you use the transport system, whether you are more in the, you can say, public transport or private mode of transport, or whether you are using the two-wheelers, where most of the time you are completely exposed in the area, and you see left, right, and front and backward, everywhere the vehicles are there, and you are like more very high. So in this particular case, we have discussed what are the aspects to be taken into account, how the synergies, like what are the different synergies we have to bring together when we are making different type of built environment, or the land use diversity, density, like where the schools should come, where the residential area should come, or how many stops, bus stops or metro stops, whatever the type of public transport is there, the design part is also going to be very, very important. Done one study on traffic policemen, and we saw the exposure level, because these are the people known for their other reasons, but hardly people see that they are doing their duty most of the time on the roadside. And I mentioned you that the emissions which comes out from the tailpipe of vehicles is the most toxic, you can say, compared to other pollution sources, including the, like when you talk about petroleum industries and so. But this product which comes out again is the output from the petroleum industries, and the emissions which have lots of, you can say, carcinogens, polycyclic aromatic hydrocarbons, black carbon. So it's very high when you see the traffic emissions are there. And this one of the study which published by the media, and it says that 45% of the traffic policemen experience shortness of breath. So this is the condition, and we were not providing any type of safety mask, or you can say equipment, to this particular type of working group. And then it becomes more vulnerable, and especially like we know, we are in the Indo-Gangetic plain, and we most of the time we experienced that air pollution in the entire Indo-Gangetic plain, whether it is Bihar, UP, Delhi, most of these geographical locations are experiencing very high air pollution in the winter, and that results into the damage to the people. When I say subject, I'm talking about here the traffic police, and the control means the people who are of same socio-economic background, but they're not working along the roadside. They may be working in malls, houses, or shopping areas, and so, and their exposure is not that high. And you can see it's a relative, you can say, response is there, where people either smoking or not smoking, but still you can see the type of actions in terms of symptoms. The dark color is for the traffic police, and most of the symptoms you can see, whether you talk about the chest pain, whether you talk about the shortness of breath, whether you talk about the smelling and odors, allergic reactions, whatever is there, you can see it's more towards the people who are exposed to high pollution. So traffic policemen are more vulnerable compared to other people, because the nature of job is completely different, and they are exposed to high air pollution. And the people who spend more time in that same profession, and they are doing the similar type of duty, you can see gradually the number of years increased in the same profession, their likelihood of chances getting more disease, more prevalence of such similar symptoms are increasing. And the same study was published by one of the media article, and that shows that 1 in 3 traffic cops in the city roads suffer lung alignment. So this shows that what we are doing, like, are we making the right strategy for the people, or all the people are exposed to the same level, or maybe some category or some particular groups are more exposed, more vulnerable compared to when we talk about in generic. So it means you need certain strategies, policies dedicated for them, and there is a need to understand, can we mitigate the problem at a right stage? If we are not going to do that, so what we say lung alignment, it may be initially, it may be the respiratory problem at initial level, but if it continues without any intervention, it may result into the lung cancer as well. And similar study we have done with the AIMS, and we found that the AIMS, what we have done, we have studied the lung cancer patients, and we have seen that the women who are having lung cancer is mostly the women belongs to the rural community, and they are indulged in the cooking where they use lots of biomass for the cooking purpose. Men we saw mostly are the smokers. So it shows that whatever the roots of exposure is there, but especially like the women, where they prepare the meal for their entire family in the rural area, and they use lots of biomass, whether it is agriculture residue or it's wood or maybe the cow dung, etc. So their exposure is so high, sometimes it's 10 to 20 times more than the normal people who are exposed in the metropolitan cities. So it means areas, when you see the areas, the concern is completely different, and it means sometimes solutions may be different looking into how the exposure is there. We have done the same experiment, like we have studied the 24-hour cycle, which generally called your entire pollution journey. When I say entire pollution journey, basically what I mean by that is like from 8 morning when you start your activity and the next day morning 8, in 24 hours, how much you exposed to, what are the concentration in which different micro environment, whether it is travel time, whether it is in your office environment, whether you are on the ambient environment or the roadside, or maybe in the ambient open outdoor activities. So we have monitored number of people, and we have monitored number of areas, micro environment, schools, colleges, hospitals, residential, you can say areas, and we get to know how much the exposure of the people are there. So like that we have done for the transport, and you can see that the air conditioned bus is the first component, and at the same time parallelly you can see the non-air conditioned bus is there, and in the non-air conditioned bus you can compare like PM10 level is almost like a double. And at the same time, when you talk about the summer and the winter, like the dark color is for summer and the light color is for winter. In winter, the concentration becomes almost double. So this shows that in both the cases, you can see our standards. We don't have, first of all, we don't have any standards for in vehicle like Hong Kong is having or Seoul is having. Few countries are having even the standards for the in vehicle activity also. But even if you want to compare with the national ambient air quality standards, you see your exposure is well above all the levels are there. So it means you can see you are not safe or you are not exposed with the safe limit when you are in a different mode of transport, except you can see in an air conditioned car where levels are more or less, especially when you talk about summer, within the limit, and at the same time in winter also very less compared to other vehicles are there. So this shows that one way it shows that we should travel by the air conditioned car, but no, if we do that, then the exposure of the other people are going to be very high. So it means the people who pollute more and people who support the environment by using the public transport basically are exposed more. So there should not be inequality among the people, like people who pollute more should be penalized, or maybe there should be a mechanism where they have to pay the cost of damaging, and at the same time the people who are damaged more should be getting some compensation so that there could be any mitigation measures for them to improve their health is there. We have done the measurements. We used multiple cars, we have used multiple two-wheelers, four-wheelers, buses, both like green and the air conditioned, non-air conditioned, and we have used the measurements both at the respiratory level, so that we assume that whatever you are exposed to is basically the level which shows that you are inhaling that particular contaminated air. When we discussed about the taxi and private cars, you will see that dark color is for taxi and the light color is for the private cars. Private car means the cars which we own and maintain. Normally, it has been seen that the private cars are more maintained and it's driven by like limited people, and it's not used by like that as compared to the taxi, which are not well maintained. And so, and most of the cases you can see the concentration, whether you talk about PM1, 2.5 and 10, is always more than double. compared to the private vehicles. So it means these are the cases where it shows that the concentrations varies even when you see even within the same taxi system, how the exposure is going to be there. So we checked like if windows are closed, if windows are open, if air condition is there, air condition is inside the mode, recirculation is on or not on. So like that, we have to check all these things, and then we find out which condition is resulting the more. We have also done, because first time in the country, I was part of this multimodal transport system where we planned for a well-connected, you can say, transport system, where the proposal was metro train, BRT, bus rapid transit system, monorail, light rail, and a feeder connectivity was proposed. But unfortunately, Delhi is only having the metro system, and all the three modes of transport, whether it is BRT, monorail, light rail, have been scrapped. So this is where you see, until we are not having a good public transport system, when I say good public transport system, if we ask the same question, the people who are sitting in this room and the people who are on online, maybe we'll get the answer. It means when we are planning something and we are not, if not asking the right user, we'll not able to get the thing. So what we have done is, we ask the people, are you willing to move to public transport? And if yes or no, what are your requirements? Like, are you feeling more comfort to be given the public transport to be more reliable? Yes. For example, if I have to go my office and office is having the biometric nowadays, and 9 o'clock, if I'm not reaching, I may be putting absent. So it means I need a weak transport system where I can reach on time and something like this. The system should be safe, and at the same time, it should not be costly also. So once when we ask the comfort level, we ask several, you can say, aspects: cleanness, air condition, seating availability, low floor, not crowded, accessibility, like that. And in terms of reliability, we ask like good frequency and adherence to schedule. Safety, we ask like less accident, personal safety, and staff behavior, which is very important nowadays. And you don't believe, like in the condition like in India, which external people, when I say external people, the developed country, when I discuss with them, they always feel because of poor country, the cost becomes a very important criteria for selecting the vehicle. Unfortunately, that was not the case. Whether it is men or a woman, gender is not matter here, because both are saying safety is the most important criteria. It means why people feel that using their own private vehicle, because they feel safe. Secondly, it is more convenient to them from the origin to destination. And at the same time, it is their own convenience is there. But if you can provide similar type of attributes in the public transport, I believe people are willing, because more than 95% of the people say yes, they are willing to move. Then second, you can see reliability, means the comfort is not very important criteria for the public. Reliability is the most important, because that's important is, if I have to take the public transport, I should be aware that at 9 o'clock, if I reach there, I catch a bus, and in next 30 minutes, it will drop me to my destination. And reliability is plus minus 5 minutes, I may be using more. But if I wait for the public bus or public transport, I don't know what time it will come, what time it will drop. I may not opt these type of transport systems, especially when I have to reach on a time or there are certain commitments. And which is the case of metro nowadays, right? Why metro is becoming more successful in terms of transport? Because the reliability is there. I'm not saying the safety is the most, you can say safety is there, because when I presented the same case, first metro, when it started in country, when we were part of the design phase of the metro and the implementer part of the metro, we found that same thing which I presented to UK Transport Department, the question comes, if it is so safe, then why there isn't a separate coach for the women? So I was not having an answer, because these public transport system in most of the developed countries, they don't have a separate coach. It means that safety level is so high, automatically their public transport system becomes more safe, which is not the case in Indian context. And you see, cost is becoming like almost like a third important criteria compared to others. It means comfort, people don't feel like comfort is the most important except a few people. But this is the most common, you can say, attribute which people perceive it, but it is not correct. And that's why if the transport planners do use such type of information while planning and the different type of modes and where how to use and how to meet the demand of the public through public transport, I think that will help and it will reduce the pollution level in the city. We have also proposed various scenarios, for example, demand management, emission norms, earlier that we have done earlier, like priority bus lane system, parking prices, freeway intercity transport, increasing the occupancy also. Now you see the carpool is becoming very important aspect. I was recently in California, I saw that one of the middle lane, they have made it for the carpool people. Earlier, nobody is interested in car sharing, especially, you know, in US case, people hesitant to share the cars because they prefer their own private and privacy into this also. But once you see that how this is going to be like impacting you, then it's going to say like how like when they are in congestion or on the road and you are waiting for half an hour, 1 hour, 1.5 hours, and just sharing the vehicle with the other person or maybe of your colleague, and so you are in the middle of the lane which is dedicated for the carpool, and you are driving fast and you reach maybe your home or your destination maybe 1 or 2 hours before. So likewise, if you see, there are lots of benefit. First, like you are not exposed to high pollution, stress level build up when you are staying in the congestion. At the same time, it's more economical. And the most important is the healthy time you save it. You may spend with for your own, you may spend with your family and like that. So if you see not only per se the environmental aspects, your socio-economical aspects, if you count, then the benefits are very high. And similar type of scenarios we have done. I will not go into detail, but I'll show you like what we have done. We have projected all the different scenarios, and you see, like for example, for Delhi, we have put interventions, and you can say this is the baseline scenario, for example. And if you put different type of interventions, you can improve the air quality, which is very visible in the diagram. So this is where once you know what type of strategies can be proposed, like in case of particulate matter, in case of NOx also. So you can plan it better if you know what type of strategy is going to work. And once the people have a habit of having the public transport, so definitely dependence on the private vehicles is going to be low. I was there in Sydney, and I saw that I saw that in case of Sydney, that the youngsters don't prefer, or means they don't prefer like the other cities or the country using the private vehicles, like owning a car or two-wheeler. I was a little surprised to see how this behavior in the youths are there, which is not the case in our case. Like in our case, youngsters, they want to prefer have their own two-wheeler or bike or car. And in the case of Sydney, I found that they like more the public transport uses. So because time was less, I was not able to have any discussions with them, but this is good example to see, to understand what behavior really motivates them to moving to the more public transport. This is one example I showed you. I worked for the Vijayawada city in Andhra Pradesh, and you see that the dark boundaries, this is the boundary, I'm trying to show this with the red color. This is the city boundary basically. And the car which is shown on this type of road, this is basically a highway which is just passing through the middle of the city. So what is thousands of vehicles, and especially the goods vehicle, and in goods vehicle means heavy duty vehicles, especially the lorries, like 12 tires, 16 tires, 20 tires. So it's a means heavy traffic, you can say a high volume of traffic is there on this particular road. And just I try to put your attention, in winter, this is the predominant wind direction, and in summer, this is the predominant wind direction. In winter, this is like this. So what is happening, whatever the number of vehicles are traveling or using this corridor, in the winter time, everything is going into the city. or most of the part city. And during the summer, definitely the entire, whatever the load is there here, and your city is up to this area. So what is happening is that entire pollution is going into the city. So it means the amount of number of vehicles are going here, even it's not only impacting the local, the roadside area, entire city is exposed to, because your predominant wind direction is towards the northwest, and this vehicle emissions continuously, it's a mobile source, and everything is going towards the city side. So this shows that how our planning goes. Maybe earlier there may be a road, NH means national highway here, but when the expansion is happening in the city, can we make a better plan? And at the same time, you will see this last bottom side, this one, this is an industry area, or many industries are there, and they also release the pollution and it goes into the city. So that shows that even within the city, how the planning is there. It's not only the transport which normally pollute a city like Bangalore, Delhi, and so, even the type of highways passing through the city, and it a continuous source of emissions are there in your city. So it means these can be easily diverted. For example, if you really want, in this case, then you can do, for example, if you shift this highway from the middle side to the peripheral side, or making like another bypass or something like this, it can be easily shifted the permanent pollution to the other side. But it's not that easy also. We know that wherever the bypass are there, again, you need another bypass for that. So it means the strategy, management, and interventions have to work together. Otherwise, it is going to be difficult into the system. So there are various, you can say, aspects which can be discussed. For example, we have done the health study of the outdoor workers, especially like street sweepers, vendors, auto rickshaw drivers, and it was highly cited by the media, and because the attention is very high. And you are going to see little surprised to see that, for example, when I talk to the auto rickshaw driver, they say that in winter air pollution is more problematic, but at the same time weather is also a problem for them. Like, for example, in rainy season, people don't prefer to use you may get wet. At the same time, in winter, you may not like to prefer again the auto, because you feel the cold, and in extreme summer, again, it's in a hot. So in all the cases, you are going to see that the auto rickshaw driver may losing their bread and butter, at the same time is also exposed high. So we must understand, is there any system we can build, or we can design in such a way that even though they know their health is compromised because of high exposure of pollution in the winter, but still because of the bread and butter they have to do. There is no alternative to that. Same way with the street sweepers. They clean the roads and the streets, and hardly they have the mask. And when they clean it, how much the dust resuspension happen, we can feel when you see it. But at the same time, there is no interventions are there. So I think my fellow colleagues were asking what type of strategies, what type of people. These are the people, like vulnerable people who are affecting the most, means which will be affected the most, like outdoor workers. Whoever is there is going to be having high damage into the system. We have done all these things for the various people. I am not showing you much of these details because of looking into the time. But what I saw is that if you just compare even the like cab drivers and auto rickshaw drivers, this side you can see it's a auto rickshaw driver, and left side it is a cab driver, because cab driver is in enclosed car and the auto rickshaw driver is in the open vehicle. You can see this much of exposure is there. So that's why once we know such aspects, we can design something. Even the vehicle can be designed differently. Even we can provide some infrastructure on the roadsides or in the city where they can take some breathe, they can spend some time, and then have a fresh oxygen, fresh you can say air, and can be diluted the impact which is already exposed to. So when you talk about this, like what can be done, like in case of the transport emissions, now we are moving to the you can say electric vehicles. I think that's one way, a good way of moving to the using the vehicles which are not emitting, but at the same time they may emit somewhere else if they are consuming the power which is generated from the fossil fuel. So our strategy should be like that. If we are promoting the electric vehicles, so the energy should be generated within the city. If it is generated from the power plant, net energy efficiency is going to be very less, and in overall scenario you are going to see city may be clean because you are having a clean vehicle, but at the same time other places are going to be having more impact because you are shifting the burden to other place. And one disastrous component may be like the batteries, which if you are not thinking appropriately, then it is going to result, means going to be an impact, impacting more. If you remember the case of CFL, we moved very far to the LED CFL because it is the you can say the contaminant which is making in a problem. Like mercury was then an issue, and which was not acceptable in the environment, and that's why we leapfrog directly to the LED very fast. So until we have a strategy more which is focusing towards public transport, non-motorized vehicle, and if your weather conditions permit, then the pedestrian safety by providing the dedicated corridors for them. These are the actions which most of the countries are following. I know if it's very hot, it is not easy to use like active transport by bicycle or by walk, but at the same time we can make the conditions more conducive so that it can be supporting and avoiding the small trips. Like for example, within 1 kilometer, 2 kilometer, you want to do those trips can be avoided when you are following the non-motorized vehicles or active travel mode of transports as well. Yeah, I'll stop here and I will be happy if you have any questions or doubts and the queries.
Thank you, Professor Jain. Big hand for Jain sir for the very nice and detailed presentation. If you have any queries or questions, yes. Yes.
Hello, I have one question, Dr. Jain. Are there notable differences in vehicular pollution pattern and impacts between urban and rural areas? And what are the factors which are contributing to these variations?
You mean like what are the factors if we consider the vehicles at the rural sector and the urban areas? So you see, sir, in the rural area, our usage of these type of transport, which we generally use in the urban cities, are not that same. Most of the time in the rural area, our focus is on the machineries like tractors or maybe the similar type of vehicles are more. But the major difference you will find out if you talk about the vehicles which are used for the transport purpose. I mean like traveling purpose. So you are going to see the vehicles like auto we use in the city and the similar type of auto we use in the rural area. Fuels are not same. Like for example, we are using CNG or petrol or diesel, which are more clean compared to what the auto rickshaw, like bigger auto rickshaw we use in the rural sectors, which is highly polluted because hardly any measures have been taken into those directions. Because you will see many of the cities, like for example, when I was talking about Delhi, on the periphery side, especially in the Uttar Pradesh side, you will see the type of vehicles they use. They are using very adulterated fuel in those vehicles, and then they are polluting more. So it's not only the periphery, even the rural areas also, they are having more polluting vehicles. But in otherwise, when you say the mode of transport, it's not that heavy problem when you compare with the city level.
Okay, sir. Thank you, sir.
Yeah.
Professor Jain, since you have worked with a lot many people who are exposed on the roadsides to the traffic, air pollution due to transport sector, could you suggest some do's and don'ts for these people who are more exposed to air pollution, especially when the air pollution level is high?
Yeah, so one most important part is, sir, for example, when we conducted this traffic police study, so we got a call from the commissioner, like, why you publish this study? No permission has been taken. Then we answered that we are the academicians, we are more liberal than anybody, and it is for the safety of a particular community. So we don't need any permission. And what we did is we told that there are certain measures can be done immediately and which is going to safeguard their health. For example, you saw that in my presentation, 2, 3 more important aspects are there. At the time you put more in the same profession, likelihood of chances of damaging your health is more. So what you can do, you can circulate or you can transfer the people from highly polluted area to low polluted areas on more frequent. Secondly, for example, you have an office work environment also for traffic police. So it is instead of like 1 year, 2 year continuously, the person is on the roadside doing the duty. Maybe after 6 months, the person can do the office based work also, so that by the time the body can rejuvenate and then you can say improve the health. And they started the every 3 months the medical checkup, so that if there is any alignment or like ill effects are there, that can be corrected on time. And they also start giving the mask and other safety, you can say, equipment, so that it can be reduced. So this is one concern for the you can say traffic police. Similarly, we can talk about the street vendors. We discussed with them, like if we provide the mask, but they are not willing to use because they feel like they have an adaptation into the same environment. But it is not true, because they always see, you will find out that small cloth they put on the mouth or like very close to the eyesight, they know that dust is going inside. And if we design some filtration system which they may feel comfortable, then only they will be willing to wear. And we have to tell them properly by giving some awareness and training that it is really affecting your health. And if they are not going to take care, then the damage is more, which they feel not, which they feel initially like, okay, and gradually they feel it's a part of their bread and butter. But they are not aware that how much damage is happening to their body, and they start living with the same type of symptoms. So I think some type of trainings, and at the more important I found is no shelter is on the urbanized area for any of the outdoor workers. For example, they want to spend 10 minutes, they want to take a break, where they have to go. You will find out in many of the developed country, they have some shelter systems. Like for example, where the clean air is there, some plants are there, water availability is there, so they can go there, 10 minutes they spend, and then they have a better feeling instead of continuously they are along the roadside. And definitely you can say the usage of filter, I am not very promoter of the filters, means mask, but at the same time when they are in a high polluted area, I think that can be done. And along the roadside, immediately along the roadside, we should not allow any type of, you can say, activity, because along the roadside, you see the tailpipe height is very less, and once you release the pollutant, immediately next to the corridor, means road, pollution level is very high. So if any activity, like you can say chai wala or anybody is there, they are going to expose more. Like people who are going to use those products may not be that much, but the person who is going to sell for the entire day or maybe late until late evening, their exposures are going to be very high. So we have to avoid such activities immediately along the roadside. We have to make certain arrangements little away from the roadside, and we can make certain, you can say, filtration system by growing the plants or other type of filters, which will reduce direct exposure of the people from the road emissions.
Thank you,
Sir,
Professor.
to add upon what you have said, sir, even automated signals and other technologies can be, advanced technologies can be used so that they don't need to all the way stand in the road. So the level will
Yes,
be
sir.
more.
Yes,
And,
sir.
Yeah.
We have proposed in 2004 and 5 all the smart, you can say, technologies, whether it is digital or artificial intelligence. But the thing is that still it's, now you see most of the cities, including Delhi, we are not using the smart technologies as on date. So that is the reason it's not giving you much benefit. At the same time, you are going to see the people who are coming there, they are spending less time. The people who are having, you can say, they stay very close to those areas, they are the more vulnerable. Like, for example, if I drive a car on the intersection, I spend maybe 2 minutes or 3 minutes, my exposure at that time is high. Or the person who is beside that roadside, for example, there is a chaiwala or some shopkeeper or traffic police or anybody, they spend more time, so their exposure is more important than the everybody else. Yeah.
Also, further to this, actually, COVID has wreaked a lot of devastating effect on the respiratory system. I don't know, sir, whether you have collected this data pre-COVID time, during or after the COVID.
Yes, sir. We have done pre-COVID only. We have done it's not done only by us. We have the AIMS doctors from pulmonary departments. We have done the physical measurements also, and it has been done by the paramedical staff. So there are lots of health alignments we have seen. And even when we studied the lung cancer with the AIMS department, pulmonary department, we observed that there are, like, when you start from any healthy person to the lung cancer level, there are 6 or 7 dots in between. If we observe these dots in the initial time with certain mechanisms can be proposed, then the bigger damage could be reduced. Like, most of the time what happens, lung patient comes, by the time it's too late, that the corrective actions could not be made. But we found that there are certain stages where it can be, you can say, designed, because nowadays artificial intelligence and deep learning, so many tools are there. And if you put all these, you can say, data into those, it will generate automatically, looking into your initial symptoms, probability of happening a particular type of damage. And based on that, we can give a proactive treatment in the beginning itself, instead of that it will get too late to correct the problem. Yeah.
Professor Suresh, if you please permit.
Yes, sir. Please, sir.
Thank you very much. Thank you very much. Nice to see you. Actually, you have told so many good things and also bad things that the air pollution is creating. Good, yes. The thing is that the liver toxicity is one of the major problem for the traffic police. If you remember the study by Chittaranjan National Cancer Research Institute,
yes,
they have reported oxidative stress, suppression, mutagenicity, urinary bladder cancer,
yes,
and the steatosis in liver. The study was carried out in 1995 to 2000. It was awarded by government of West Bengal. And the West Bengal government, it didn't publish it because of all this problem.
Yeah.
But this study triggered the transformation in the traffic system, unmanned system, signaling system. All these things came. I was just went through that report, just to inform me. The one thing about is the carpool that I have learned from Professor Padmasri Dilip Biswas. Whenever you used to stand in a bus stand, you used to, Shaha, you would like to go somewhere, or can I drop you on my way? This is the person. So this is the real boost. Signal-free road, this is one of the concept is coming up nowadays. That is clearly demonstrated in Hyderabad. No traffic signal on the road. Even on the main roads, there is no traffic signals. There are time confidence. What I studied, time confidence is one of the factor. If that can be taken into consideration while defining the mass traffic ban, that can resolve many more our issues. One thing is winter is an issue in the IGP. The staggering of the school and office hours can also be thought. Shortening or rather than closing the school, short school hours, early morning school hours, or depending upon the meteorological condition, or on the forecasting of the air quality, Those also can be think of, because the grab does not prescribe that one. We can also think in that way. Thank you very much. I've just added some of the issues, but enjoyed your lecture thoroughly. Thank you
sir.
so
Thank
much.
you. Thank you very much, sir. Thank you. Yeah, absolutely. The last point is very, very important. If I see, I had a observations, like for example, sometime, and that has been proven during the Corona time. First of all, it has been given that health is the fundamental to sustainable development. You remember the first lockdown, because we were not having any options to correct the problem and everything was locked down. It means we learned that we are more important and health is more important. If we survive, we can do certain innovations later, and that shows that it can be done. At the same time, we studied, in fact, not I studied, I being the Dean Academic Affairs of IIT Tirupati, I studied lots of stress to the students were there. Only reason being they were more on the screen and hardly any physical activity. And so I know that there is a trade-off. If we shut down if we only, I'm talking about shutdown, if we come up with the alternative mechanisms of different timings, that's good. But shutting down of schools is not going to be an apt solution. Reason being is that if they have to work online or something like this, the mental health or impact is going to be very high. And when you are going to talk about the trade-off, this trade-off is going to be more damaging than the exposure to the air pollution. So it means definitely we know that looking into the air pollution level, early morning hours, late evening hours, the pollution buildup is more. So it can be like as the sun rays, means the sun is shining, there is dispersion, more dispersion, and definitely the pollution level go down. So timings can be done, like as you suggested, timing can be more important. Can we move forward or backward the dates or the time of the schools? So that can be a good solution for the schools as well. Yeah, thank you, sir.
Professor Suresh, I have one
Ji, sir.
question, because
Ji, sir.
I'm more concerned about the individual point of view. Whether how can we be safe inside our house? Like indoor pollution is there, inside the offices also. What we should do, or what measures should we take that we should feel safe at least in our house or office?
Yeah, sir. So this has been very seen that there are two types of buildings are there when we talk about offices, for example, or even houses also. That one is the air conditioned building, and which is second is the natural ventilated building. So in case of air conditioned building, if our filtration system is active and it is taking care of, like instead of putting in an air purifier at multiple, you can say offices, and so the same filter can be there always on the duct, where the inlet is there for the air conditioning system. But if we are not having a common type of air conditioning, then definitely it's a challenge. And air purifier can be a solution, but I generally don't recommend that, because the people who are in the such environment, they are not really exposed to that much of pollution level compared to when offices are very close to the roadside or area where highly, you can say, pollution sources are there. Otherwise, it's not going to be that much of problematic if we maintain proper ventilation system in the houses by putting the air conditioning or other means of natural ventilation system. I think that will take care. Air purifiers only works when we really see the areas where it is a highly polluted, and infiltration is also very high. Infiltration means if our leakages are more and air conditioning is there, but at the same time open system is there, so there the accumulation may be more. In such cases, we can prevent by providing a better ventilation system. Or the people who can afford, definitely air purifier can be in a solution, but I believe it is a temporary solution for them. Yes, if the people are having already certain problem like respiratory or COPD, asthma type of things, for them, yes, we can say that, because the damage is more. If they will safeguard through that, I think that can be doable. Plants, people perceive the plants are also solutions, but all plants are, or all the houses are not like safe when you use the plants. For example, if adults are there, you can use the plants. There are multiple plants are there, which can be used inside the house or exterior side also, which can give in a better, you can say, protection. But if you have the kids, or you can say means toddlers are there or small kids are there, sometimes the plants also become an allergic agent to the kids also. So in most of the cases, doctors also suggest, if you have kids or small children, in that case we shall avoid the plants, because there are bioaerosols and some other allergens are there which damage the health of the kids. But if we are having normal adults, like in the office environment also, we can have the plants also, which can have an added advantage to the some extent, like purification in terms of adding the oxygen level, and some you can say retention of the particulate pollution as well.
Thank you, Professor.
Yeah,
Thank you, sir. Neeraj, could you please check the chat box? Something. Okay. Okay. So a big
Questions from the
Ah.
virtual first.
So participants who have joined us online, do you have any further questions? Okay, so a big hand for Professor.
Thank you, sir. Thank you for giving the opportunity. Thank you.
Really very delighted to have your to listen your lecture. And now I would like to request our chairman, sir, for his valuable words way forward and announce the next. This is it.
Thank you, Professor Jain, for this very interesting lecture. In fact, after few months, I could find out some lectures we could understand something, because mostly the professor of IITs they do something scholarly, and we fail to understand the meaning most of the things. But this is very good lecture, and it is very practical also, because we are trying to implement something for the traffic police, the street vendors, and auto rickshaw driver. Because in winter, the condition in Bihar, it is very pathetic, and everybody is expecting something we should do. That's why I am asking you what we should do it, because people are also not safe to inside their houses also. So, and there is a lot of studies by WHO that if you are in Patna, your life is reduced by 30 years. If you are in Delhi, it is reduced by 8 years. Another problem is that whether you find that the norms set by the World Health Organization, the pollution norms like PM 2.5, so much PM 10 this way, whether it is a practical for Indian condition, or we are aiming something which we cannot achieve, in fact. But nobody has achieved, no state or no city is achieving this except Ladakh and some few places. So why we should have such norms or some standard for pollution?
So that's sir, answer I've given during the Corona time. Even when everybody was stopped, almost all the industries were shut down. Vehicles only which are of specific use were driven. Means almost all the activities were there. That time you was not able to achieve your WHO standard. Then why we discuss all these things? Because something which is not like, we have to set the target which is achievable, and we are not supposed to discuss the things which we cannot achieve at least in next 15 or 20 years. Reason being is that it's not that we are polluting. Our, like Dr. Shah also knows that our geographical locations, our climatic conditions, our meteorology, that whatever you stop everything, still it will be more than the WHO standards, what the current WHO standards are there. So first target should be what we are having, the national ambient air quality standards. And then once we achieve that, then we think of like appropriately looking into our progress, the country's growth and acceptability in terms of the exposure. Then we have to think how much further we can improve. I think going towards the WHO, I'm on screen, maybe people are listening, doesn't matter, but we are hitting something in dark which cannot be achievable. So yes, this is very clear. It cannot be achieved. What I'm saying in next 10 or 20 years, definitely it cannot be. Which can be achievable, right? So hitting a wall will affect us only. It's not going to solve the problem.
People like IIT people, they can suggest some to government that they should have some practical standards. Because there is no point in having a standard which we can't achieve it. We have never achieved it. So why should we have it? And what is happening? It gives it's just demeaning the country also. Because it's a polluted country all over the world. We cannot achieve that standard.
That's true, sir. That's true. And somewhere our conversation should be on that direction.
Yeah,
So that
polluted are different, you know.
Sir, you have suggested that people should not be exposed on the roadside, but unfortunately, all our activities goes on the roadsides only, right from
that's why I'm saying. That's why I'm saying, sir. Only a few communities which are more vulnerable compared to everybody. Like I remember, yeah, yes, sir.
Thank you very much for this enlightening lecture. And this series of this scientific interactive series of lecture. The next lecture will be on water pollution and recent trends on water conservation by Professor S.K. Sinha, PIT Patna. Thank you very much again for the lecture.
Thank you, sir. Thank you very much. Thank you.
Now I would
So,
like our senior colleague, Sri S.N. Jaiswal ji, scientific advisor of the board, to propose a vote of thanks on behalf of all of us.
धन्यवाद नवीन जी। धन्यवाद की औपचारिकता पूरा करने के क्रम में सबसे पहले मैं धन्यवाद देना चाहूंगा अपने इस कार्यशाला में जो आज जो वैज्ञानिक व्याख्यानमाला में डॉक्टर सुरेश जैन साहब द्वारा जो व्याख्यान दिए गए, विशेष रूप से वायु प्रदूषण और उसके विशेष करके वाहनों से होने वाले उत्सर्जन और उसके वायु प्रदूषण के प्रभाव जो हमारे स्वास्थ्य पर पड़ते हैं, इन सारे बिंदुओं को समावेशित करते हुए आपने व्याख्यानमाला में अपने परिचर्चा में अपने उद्बोधन किया। इसके लिए बहुत अच्छे तरीके से साइंटिफिक बेस्ड डाटा के आधार पर आपने रिसर्च ओरिएंटेड जितने भी डाटा थे उन सबको समेट कर डाटा दिया आपने, बहुत अच्छा लगा। एंड होप दिस फाइंड कि सभी लोग इससे सहमत होंगे और आगे इससे कुछ सीख लेंगे। जैसा हम सभी जानते हैं कि वायु की कोई भौगोलिक सीमा नहीं होती है और साथ साथ हमारा वायु प्रदूषण का स्तर मौसम के अनुरूप बदलते रहता है। इस स्थिति विशेष पर किसी स्थान विशेष पर मौसम कैसा है, उसकी भौगोलिक सीमा कैसा है, ज्योग्राफिक सीमा, उसके अनुरूप मौसम की स्थिति या पोल्यूशन की स्थिति बदलती रहती है। और यही स्थिति कमोबेश जो हमारे इंडो गैंजेटिक प्लेन में रहता है, जिससे हम लोग को प्रभावित होते रहते हैं और वायु प्रदूषण के जो स्वास्थ्य पर हमारा असर पड़ता है। और यही इसी सब बैकग्राउंड के लेकर के जैसा हम सभी अवगत है, एयर क्वालिटी इंडेक्स जो हमारा बना हुआ है स्टेट में जो हमारा गुड से लेके और बैड सिवियरिटी तक में जाते हैं हम लोग, उस सभी में हमारा ऑलरेडी वेल डिफाइंड में हेल्थ इम्पैक्ट्स डिफाइन किया हुआ है कि जो हमारा एयर क्वालिटी क्या होता है, कि अच्छा होता है, क्या संतोषप्रद होता है, मॉडरेट होता है, सब की स्थिति में हमारा स्वास्थ्य के लेवल क्या हो सकता है और हेल्थ इम्पैक्ट कैसे परिवर्तित होते रहते हैं, उस सभी पर ऑलरेडी वेल डिफाइंड में रोड मैप ऑलरेडी हमारा दिया हो गया है। आपके व्याख्यानमाला में निश्चित रूप से यह उभर के आया कि अभी जो हमारा मेन वाहनों से होने वाले उत्सर्जन जो होते हैं उसके प्रभाव के कारण या और भी जो सोर्सेस है उसके कारण सबसे ज्यादा जो हमारे ऑटो ड्राइवर हैं और या फिर जो ट्रैफिक पुलिस है या रूरल क्षेत्र में जो लेडीज जो हमारे वुमेन्स हैं वो सभी प्रभावित होते रहते हैं। तो ये सारी चीजें हैं, बट निश्चित रूप से जो वायु प्रदूषण के जो हमारे वाहनों से उत्सर्जन की दिशा में वायु प्रदूषण के रोकथाम के लिए हमारे देश में भी बहुत ही नॉट ओनली लिमिटेड टू कंट्री बट हमारे देश में भी पूरे नेशनल लेवल पर और स्टेट लेवल पर भी काफी ड्राइव्स लिए गए हैं। तो हमें जो समस्याओं को खाली जो हम बताते हैं ये समस्याएं हैं, इसका प्रभाव हो सकता है, बट जो लेवल ऑफ इनिशिएशन किया गया है राष्ट्रीय स्तर पर या राज्य स्तर पर, हमें उस पर भी प्रकाश डालने की आवश्यकता है। जैसा कि अभी देखेंगे हम लोग व्हीकल पोल्यूशन के संदर्भ में जो हमारा फ्यूल क्वालिटी था, हम पहले अपने स्थान कुछ वर्षों पहले फ्यूल क्वालिटी क्या हो सकती थी, हम आज भारत स्टेज 6 पर जाए हैं। हमारी क्वालिटी फ्यूल क्वालिटी दिन रात हम लोग दिन पर दिन इम्प्रूव होती जाती है। तो ये हमारे नेशनल इनिशिएटिव लिए गए हैं कि वाहनों उत्सर्जन कैसे कम सकते हैं। टीम सेंटर्स जो है, टीम सेंटर्स भी हमारे स्टेट बहुत कम हुआ करता था, अब लगभग जो है लगभग 1500 के आसपास में लगभग हमारा पीयू सेंटर पूरे बिहार में बन गया है। तो वी आर ट्राइंग टू मॉनिटर द इमिशन फ्रॉम द व्हीकल्स थ्रू द पीयूसी सेंटर्स एंड दैट वी हैव ऑलरेडी इम्प्रूव, नो डाउट। तो जो हमारा जो वायु प्रदूषण जो प्रदूषण का स्तर है, जो उसके कारण प्रभावित होते हैं, उन सब पर आपका ध्यान आकर्षित किया गया। और जो स्टैंडर्ड्स की अभी बात हो रही थी, अभी स्टैंडर्ड्स के बारे में 2009 में जो स्टैंडर्ड हमारा एम्बिएंट एयर क्वालिटी स्टैंडर्ड हुआ, उसके रिस्पेक्टिव वाहनों से होने वाले उत्सर्जन का अलग अलग स्टैंडर्ड डिफाइन किया गया, वो भी हुआ। लेकिन स्टैंडर्ड जो है, स्टैंडर्ड निर्धारित करने का मापदंड हेल्थ इम्पैक्ट होता है। तो WHO का स्टैंडर्ड जो है डेफिनेटली, चाहे हमारा इंडियन नेशनल स्टैंडर्ड है, वो सारे का बेस लाइन तो हमारा हेल्थ इम्पैक्ट होता है। और हम देख रहे हैं कि हेल्थ इम्पैक्ट पे क्या प्रभाव होता है, वेल एस्टैब्लिश फैक्ट्स है। तो जैसा कि अध्यक्ष महोदय बता रहे थे कि हमारा एम्बिएंट क्वालिटी और WHO के स्टैंडर्ड में कुछ ऐसा करना चाहिए, निश्चित रूप से हमें उसमें सोचने की आवश्यकता है। बट जो स्थितियां हैं, जैसा आपने बताया कि कोरोना काल में भी उसका जो है स्थिति देखिए, अगर हम उस एयर क्वालिटी को मीट नहीं कर पाए तो सिर्फ स्टैंडर्ड को रिवाइज करने से काम नहीं चलता। हमको अभी स्थानीय स्तर पर जो ज्यादा सोचने की जरूरत है, एक्ट करने की आवश्यकता है कि जिन कारणों से प्रदूषण हो रहा है वाहनों में, हम जो आपने बताया बहुत अच्छा चीज में पब्लिक ट्रांसपोर्ट सिस्टम इंप्रूव करना चाहिए, इफिशिएंट मैनर में अर्बन ट्रांसपोर्ट डिजाइन सिस्टम डेवलप करना चाहिए, और जो सिंक्रोनाइज ट्रैफिक ऑटोमेटेड ट्रैफिक सिग्नल से उसको अडॉप्ट करने की आवश्यकता है, कार पूलिंग की आवश्यकता है। इन सारे चीजों पर ध्यान देंगे तो निश्चित रूप से हम वाहनों से होने उत्सर्जन को कम प्रभावित होंगे और अपने परिवेश को स्वच्छ और स्वस्थ रखेंगे। तो मेरा आशा यही है कि धन्यवाद ज्ञापन में सभी लोगों को, आप लोगों ने जो अपने इसमें भाग लिया, सबको बहुत बहुत धन्यवाद। जो ऑनलाइन सिस्टम जुड़े हुए हैं उनके भी बहुत धन्यवाद, और विशेष करके अध्यक्ष महोदय जो बिजी शेड्यूल के साथ भी हमारे इस कार्यक्रम में आके हमें हमारा मतलब कि आशीर्वाद इसमें मोटिवेट किया, और इसलिए उन्हें बहुत बहुत धन्यवाद। और सभी लोगों को इस कार्यशाला में भाग लेने के लिए धन्यवाद। मैं आशा करता हूं कि इसी तरह से व्याख्यान माला करते हम आगे लोगों को इसके माध्यम से लोगों को जागृत करने का प्रयास करेंगे और अपने लक्ष्य को प्राप्त कर अपने परिवेश को, अपने पर्यावरण को स्वच्छ और साफ में रख पाएंगे। धन्यवाद।
थैंक यू जयपाल जी। हमारे साथ इस कार्यक्रम में NIT पटना, BIT पटना, आदरी और BIT मिश्रा के सभी पार्टिसिपेंट्स जुड़े हैं। आप सभी का भी बहुत बहुत धन्यवाद, और हमारे कार्यक्रम को सफल बनाने के लिए बहुत बहुत आभार।